Louise, I wanted to start with you and ask you what the last couple of years have been like working in ICU.
It's really been something I've never been through before. I've worked in ICU this time for 30 years in the same unit here at Westmead, and this is unprecedented. The levels of stress, the amount of overtime, we're close to breaking, and we've been at that point at different times for the last 2 years. It's incredibly stressful, lots of mental health issues for staff and droves of staff leaving. So the problem's just been compounded by a lack of support and response from the local health service and from health generally. It's getting really dire.
Daniela, is this a big decision for you to take strike action, to walk off the job today?
It really is. It's not what we want to do, but we feel like we're not being heard. So it's just come to the point where we just have to do something. Something's got to give.
Now, you're after a 2.5% pay rise. You want to see improvements in the patient to staff ratio. Why is the ratio issue so important?
It's really vital. I think it's at the heart of why we're in this situation. We were understaffed in intensive care at Westmead specifically before COVID, and this has just enhanced those shortages and made the situation so dire. If we have mandated shift-by-shift staff ratios, as they do in Victoria and Queensland and WA, then if we're short-staffed, then those states will close beds. So nurses aren't being made to go the extra mile and have unsafe staffing and lack of care for patients. And that's why staff are leaving, because of the stress of looking after 2 ventilated patients, a number of critically ill patients. If we can provide those safe staffing ratios that are mandated shift to shift, then people will stay in the system, and that will be a really great retention strategy. And we just want to provide the safest, best care that we possibly can, and that's why it's such a huge thing that we're striking today.
Daniela, many of your colleagues have left the industry, as Louise was saying. If the government relented Daniela, I'm going to ask you whether you think that nurses and staff would be encouraged not to leave the industry, that they would stop walking away from the job if the pay rise came through, if the staff ratios would change. Would that be enough, given the burnout you've all been suffering?
100%, because the staff feel like they're not being heard. That the work that we're doing, what we're putting into currently, it's just not equating to what we're getting. Especially with the wage freeze last year, at the height of the pandemic, we just felt like nothing was being done for us.
Did you have any second thoughts?
A big slap in the face.
Did you have any second thoughts when the Industrial Relations Commission last night banned this strike?
Not at all. We're still here. We know what's been going on our wards, so we still really wanted to come out and strike.
And Louise, just a last word. You seem to be indicating you've not ever seen anything like this before, as far as the stress that you're seeing on the system.
Yeah, absolutely. It's I've worked here for 30 years. I trained here back in the 80s. We've had different influenza pandemics. We've had influxes of people into intensive care, but nothing like this. And the combination of the staff leaving and the acuity of the patients and just the sheer numbers that we've had, it's just been a sort of perfect storm of events that's just led to so much stress and staff walking away. They're just voting with their feet. So I've never seen anything like it, and it's been really scary, and it's had a huge impact on everyone I work with.
Louise McCann and Daniela Asamar, thanks for joining us this morning.
No worries.
Thank you very
Our pleasure.
much, guys.